the research shows, and common sense would tell you, that trust really begins at home. It begins in local communities. It begins with trust in your doctor. It begins with trust in your local public health officials or even faith leaders. And so we felt that one initiative that might be of real help would be to begin to do a better job of empowering these community leaders to carry messages on public health. The other is communications. Certainly during the pandemic and at the beginning, it was quite clear that getting the messaging straight was not something that the government, our government at the time, was particularly good at. And it's difficult in the area of public health because things change, the science changes. And so understanding how to use communications effectively to build trust is incredibly important. And we saw in some places, for example, here in North Carolina, Mandy Cohen, who's now the new director of the CDC, at the time was running the healthcare system here in North Carolina, and she was credited, frankly, as having done among the best job of bringing together various communities within and stakeholders within North Carolina to develop a coherent message around COVID. But that was not the case in many places. And so this second area of communications is, we think, so important.